Dr. Andrew Snyder. I'm a psychiatrist, and I'm board certified in addiction medicine, as well as psychiatry, general adult psychiatry. And I work primarily in adult psychiatry, both at the VA and also here at Foundations Petersburg. I'm working here as a medical director, getting started with the psychiatric services and substance abuse treatment program here. There's really a tremendous amount of evidence that suggests that mental health problems in general, including depression, anxiety, bipolar disorder, etc., are linked to substance use and the risk of relapse and overdose. And now the idea is basically that when you're treating one or the other, there's still benefit, of course, in the sense that the patient may experience a reduction in symptoms that pertain to that particular disorder, whether it's depression or opioid use disorder. If you treat them individually, there's still some benefit. But if you can treat both, especially at the same time, it's still a subject of ongoing investigation and research, but there's a lot of evidence that exists now that suggests that there's a kind of synergistic benefit in treating both. And the reason is primarily that the two reinforce each other, the symptoms of mental health conditions as well as substance use disorders. So if one is feeling depressed, one might resort to using a substance like heroin or cocaine or whatever in order to feel better in the moment, and that further can reinforce the symptoms of low mood and depression when they come down from either of those substances and go into withdrawal and feel even worse. And so the idea is that when you treat the substance use problem, you're preventing or helping that patient to avoid further use, and you stabilize that particular aspect of their mental health needs. And then when you treat the mental health condition as well, the depression, the anxiety, whatever it is, you're reducing the reason that or one of the reasons that they were using in the first place. Again, so it creates this virtuous cycle where there's less desire to use, they feel better, and therefore have even less desire to use, etc. It's a synergistic process. Some of the things that make Foundations Petersburg so special are the people who work here and the investment that they have in the outcomes of our patients. Our people really do care about how well our patients are doing, and we go to significant lengths to try and make sure that and do our best to make sure that they have the best chance of recovery. We also have integrated psychiatric and substance abuse treatment services that I think, again, for some of the reasons described earlier, are so important for maximizing the chance of success in treatment and reinforcing that recovery so that patients can get better and stay better and have the skills and all the have all the needs met required to sustain that recovery. We also have a brand new state-of-the-art facility here too, which is something that is a relative rarity in the substance abuse treatment field. And so patients can come to a place where they can receive professional care in a modern healthcare facility, which I think further establishes the positive patient care experience and also better outcomes in the future.